Spinal pain is a growing concern for millions of people worldwide, affecting their daily life, mobility, and overall well-being. Joining us to tell us more this morning is Dr. Mark Hornyak, neurosurgeon, chief of neurosurgery at Backus Hospital. Doctor, thank you so much for being with us this morning. A lot of people can relate to this conversation, I'm sure. What are the most common causes of spine pain?
Well, thank you for having me. And yes, as you mentioned, spine pain is a common problem. More than 80% of people will take a day off of work because of it. But really, the answer is simple. The vast majority of spine pain is caused by strained muscles. Very simple concept. Very painful, and it generally is self-limited. But as the body ages, we get arthritis and things, and disc degeneration and joint arthritis within the spine are probably the other two most common causes.
Doctor, what signs and symptoms should people be looking out for? And at what point do you need to actually go and see a doctor in person?
Yeah, this is super important. Most pain, even when it's really severe, again, muscular, is going to be self-limited and will get better with time. It may take months, and it may take a lot of conservative care, but it should get better. If your pain persists for a long period of time, that's concerning. If it's getting worse rather than better, that's concerning. If it starts in the spine, but then it's kind of spreading out from the spine, neck into the arms, back into the legs, that's concerning. And when you start being associated with numbness, tingling, weakness, those are the signs that are even more concerning. So all this care should probably start with your primary care provider, but talk with them, and they should feel out a program with you and send you to a specialist when it's necessary.
Doctor, can you tell us more about alternatives to spinal fusion and what other treatment options are available at Hartford Healthcare?
Right. So at Hartford Healthcare, we've got all your bases covered. And so we it starts with your primary care provider, as I already mentioned. And we have physical therapy. We have a radiology department that offers the most advanced imaging. And if all this stuff ends up, you need to end up in the office of a surgeon like myself, we have highly specialized operating rooms, which include navigation, image-guided surgery, robotics, microsurgery, minimally invasive surgery. We've got all that covered. The traditional, approach to spine surgery is with decompression and fusion. And fusion is a technique that, takes a faulty joint and locks it together. It removes the joint. And that's a great way of removing pain. It's the gold standard, been used for decades. But really, my interest in this is the cutting edge opportunity to preserve motion, to avoid fusion. Okay. And we can do that by, instead of locking bones together, which causes stiffness and actually can injure the adjacent segments, we offer alternatives such as a disc replacement surgery, kind of like an artificial joint, or artificial facet joint surgery, again, similar to like knee and hip surgery. We wouldn't lock your knee together. So we're trying to avoid options.
Hate to cut you off real quick on time. Can you just tell us quickly about this Zoom event you have coming up today?
Yeah, we're going to be talking about these same things via Zoom later today, so we would invite anybody to join in.
All right. Doctor, we appreciate your time. Thanks for being with us.